Hi, everyone, and welcome to Understanding Health in the Southeast Region, a health literacy masterclass series. My name is Dr. Laura Geyer, and I'm your program moderator throughout the entire series. We have 3 learning goals for our masterclasses. First, that at the end, you're going to be able to explain the interlocking systems that are associated with individual and population health in the Southeast region. And the Southeast region includes 8 states: Alabama, Kentucky, Florida, Georgia, Mississippi, North Carolina, South Carolina, and Tennessee. The second goal is that you'll be able to describe the social determinants of health that may be limited among priority populations and lead to health disparities. And third, we're going to leave you in a position to be able to propose actionable, interprofessional, and interdisciplinary solutions for meeting health-related social needs to improve health outcomes in your community. Our program sponsor is the Mississippi Public Health Institute, and since 2011, the Institute has been working to improve health in Mississippi. In this series, they're expanding their reach to include the Southeast region. Our funding partners include a public health infrastructure grant and a Region 4 Public Health Training Center grant. There are 2 audiences who will be participating in our master classes for training. The first group is health professionals who are already in practice. We're talking about physicians, dietitians, nurses, pharmacists, perhaps athletic trainers, and more. We're offering continuing education credits along with the master classes that you complete. Our second group is students who are enrolled in training. So if you're in graduate school completing your Master of Public Health degree, or if you're in medical school, nursing school, dental school, then this series is being developed for you. We have a panel of experts that I'd like to introduce, starting with Dr. Stephen Farrow, who's a professor of medicine, endocrinology, and innovation at the William Carey University College of Osteopathic Medicine. We have 2 individuals who combined their resources and expertise to develop a presentation about literacy. Dr. Angela Rutherford, who's a professor of teacher education and director of the Center for Excellence in Literacy Instruction at the University of Mississippi, partnered with Alyssa Hobart, who is the director of the Mississippi Campaign for Grade Level Reading, also at the University of Mississippi. Lauren Jones joins us from the community to discuss the evidence-based program that she co-founded and now directs. The name of that program is Mom Me, also located here in Mississippi. Dr. Jonathan Hanses, director of the ACT Center and Lung Cancer Screening Service at the University of Mississippi Medical Center, has joined us for this series, along with Pandora Redmond, who is the director of Hearty Helping Food Pantry here in Mississippi. Ryan Kelly is the executive director of the Alabama and Mississippi Rural Health Associations. And Scott Darius is the executive director of Florida Voices for Health. I'm joining you from Florida, where I'm an associate professor of medical education at the University of Florida. The model we're using as a guideline for our master classes include the following. You can see on the far left a representation of the state of Mississippi. This image has been selected because we want to talk about the geospatial determinants of health. Geospatial is used to describe any kind of geography with a health marker. So when we look at this image, we can see the state of Mississippi represented. Well, that's a geographical marker to look at the state. And within the state, we can see several additional markers that include the county, the zip code, and in some instances, we might want to drill down into the census district. Moving across this slide, we move into a more formal model, and this is the model that's used by the Robert Wood Johnson Foundation to describe factors that affect population health. Starting at the very bottom in the orange box, we see policies and programs. Policies and programs describe the political determinants of health. And throughout this series, when we talk about political determinants of health, we're using the word politics in its most simple fashion, and that is to describe the way that different groups who live together in society can work together to get stuff done. So policies and programs really determine how resources within communities are distributed. And those resources, moving to the right, describe the social determinants of health. So you see the red box that includes the social, the economic, and also the environmental factors in communities. These are the social determinants of health. And then continuing to move right, we see that we have a bigger box that includes the social determinants of health and the health factors associated with clinical care. These are described as health-related social needs, and we can screen for them using individual questions to learn about how personal health, the status, and how well it's managed. The topics presented in this series will include a welcome and an introduction by Dr. Daniel Edney, who is the Mississippi State Health Officer. His welcome will be followed by our 10 master classes. We're going to start with just a general overview of the social determinants of health as a starting point for health improvement. We're then going to return to our model and start with those geospatial determinants of health. Ryan Kelly is going to introduce a framework of the rural health support system, because living in a rural area is very different from an urban area, and rural versus urban is a geospatial difference. Scott Darius then is going to introduce the model when he talks to us about using storytelling as advocacy. So he's going to describe those political determinants of health. And we then move into looking at social determinants of health when Pandora Jones introduces the evidence-based program that she manages, Nourishing the Future, How Food Access, Strategic Partnerships, and Policy Collaboration Can Transform Health in Underserved Communities. Her masterclass will be followed by Alyssa Hobart, who will discuss reading between the lines, addressing literacy to improve health outcomes. I'm going to introduce a masterclass to equip providers to better equip their patients. Prepare, activate, engage, a 21st century model for provider appointments. We're then going to move into the next section of the model beyond the social determinants and look at additional health factors, such as clinical care. Lauren Jones will talk to us about the program that she co-founded and now directs, Improving Maternal and Infant Outcomes Through Mental Wellness Initiatives is the topic that she'll present. And that will be followed by a masterclass by Dr. Stephen Farrow, Master Obesity and Diabetes, You Can Do It. We then advance in the model to the factor that's most important for us to address in the Southeast region is tobacco use. And Dr. Jonathan Hansis is going to provide a discussion about tobacco cessation. We're going to end our series with a capstone masterclass and a call to action as Partners for Health. And now a few words from Dr. Edney.
Hi, I'm Dr. Dan Edney, the State Health Officer with the Mississippi State Department of Health, and thank you for being interested in the topic of health literacy and joining us for these important educational sessions. It matters not if we're trying to communicate in Mississippi or Georgia or anywhere in the Southeast. It's important that we do so in a way that we can convey teaching principles to those who need to learn the health principles that we're communicating in a way that they can understand. That's transparent for them. It's at the reading level that the average person in the population can understand, and that we do it in an effective way so that they can learn the things that we need to teach. As a doctor in Mississippi, this is how I communicated to my patients. I tried hard not to use medical jargon any more than I had to. As state health officer communicating to the public of Mississippi, likewise, I try not to use public health jargon. I try to communicate in a way that the average Mississippian will understand. And I use the technique of just talking like a small town doctor, which has been very effective for me. I get a lot of positive feedback that the way I communicate makes sense to the average Mississippian. And that's going to translate throughout the Southeast. We know that primary prevention is the most important way that we can invest to get the biggest bang for the buck in public health. And primary prevention is all about education. If we're not using health literacy techniques in education, then we will fail. So health literacy, in my opinion, is where it all begins. What you're going to be learning in these sessions will be world-class information to help us all communicate more effectively to the populations that we serve. And because of that, we're so glad that you're here. Thank you.